My name is Amit Goyal, and I am a Cleveland Clinic Cardiology Fellow here with you as part of the Circulation COVID team. Honored to be joined by Professor Marco Metra from the University and Civil Hospitals of Brescia in Italy. For our audience, Professor Metra is Director of the Institute of Cardiology at the University of Brescia and Editor-in-Chief of the European Journal of Heart Failure, among many other titles. Professor Metra, thank you for being part of our initiative, Circulation COVID, Updates from the Front Lines. As we gear up to face this pandemic, we want to get your perspective and learn from you in terms of how you are battling COVID-19 and the lessons you've learned along the way, especially from a cardiovascular perspective. So thank you so much for your time, sir.
And thank you for inviting me to share my experience with you and all the participants. Actually, I've been for a long time in the practice of medicine and cardiology, but what's happening and what's happened is really I mean, it has been defined as tsunami, whatever. It's surely a epochal event. It's a major change in our practice, and we still cannot tell what it is going to be. Its evolution. But to give you an idea, my institute includes 60 inpatient beds plus 12 intensive care unit beds, and it's now almost completely with patients that are cardiac patients, but with COVID infection. And also the intensive care unit is subdivided. So there has been a major change in the patients. And of course, what I can say is that maybe the most difficult time has been at the time of the change, when we realized that some patients we didn't think they were infected, they had been actually infected, and probably they had transmitted the infection to other patients or to other doctors. Therefore, one very important thing, I don't know how much you are in the United States at this stage, but we have started to think that every patient, every colleague might be infected. And therefore we have to take all masks and everything, life vests, to protect ourselves from the infection, because this is the first thing. Another thing that I think it has been a relatively mistake in our cities is that the testing for COVID infection must be done as large as possible, and for sure I think it should include all the medical personnel and nurses that are potentially dealing with COVID patients. Because it's very important to identify early enough the potential carriers, even if asymptomatic. So these are the important measurements to be taken. Protect ourselves. Always think that we may be dealing with an infected person, and have the wider use as possible of the testing.
Thank you so much for that. And you know, when you call this a tsunami, I think that imagery is very much true. And I appreciate your call to the need to protect the healthcare workers who are on the front lines. And I'd like to highlight that what you're saying is your practice is very different from our guidelines. Our guidelines is only to use protection in the presence of a known COVID positive patient. And that's also tied with some restrictions on how we're able to test for COVID positivity. Your practice seems to be very different. What are you actually doing in terms of what PPE you're wearing and when you're wearing it?
I don't know the English word very well. Let me tell you what you have told me is what was my practice 1 month ago.
I see.
Then you have to learn to change your practice, and this is one of the impressive things that we are facing. So we always wear at least surgical masks, if not FPP2, which are better, or FPP3 masks that are really protective. Then you have to, we generally use a cap for our head, and then we use we cover our body with a vest, so that the clothes do not have contact with the droplets. Of course, I mean, the virus enters just through the mouth or the nose or the eyes. So there are not many possibilities. And the most important thing is do not touch with our hands these parts of our body unless they are properly washed. The other thing, we wash very compulsively our hands with alcoholic or chloride solutions. I forgot, we wear gloves. And when we have to visit a COVID positive patient, we also have a device to cover our eyes or glasses, maybe glasses or maybe a screen. But the important thing is that always think that we may be infected. And the major mistake is not thinking that this may happen, because in this case it happens. If you think it can happen, you prevent yourself. And the main problem is this: you have to avoid. I mean, it's a catastrophe. So what is the characteristic of a catastrophe? Is that the demand on the healthcare system is greater, by far greater, of what the healthcare system can offer. So if a country or a city or an hospital can decrease the number of patients coming every day, it doesn't matter if it's going to be long. But if it is 5 patients every day, the hospital can afford them. What the hospital cannot afford is to have 50 patients or 500 patients, or in our hospital is 100, from 80 to 100, 110 patients every day. And the time of the admission to the hospital, the length of the stay in the hospital is long. Is not going to be less than 14 days, and it can be much longer. So this is the problem, that you have to admit the patients, and you don't have the turnover that is necessary to have places for new patients. So it's very important prevention to decrease the number of patients coming every day.
Thank you, sir. And I appreciate that you're highlighting that prevention is extremely important in an epidemic time like this. And this is a catastrophe, not a theoretical hypothesis, but a reality for us. And I think a big part of arming ourselves to face this, we need to learn what is the best knowledge currently available. And we are all hearing about the many cardiovascular implications of COVID-19 and the increased mortality associated with these cardiac manifestations. So I ask you, Professor Metra, in patients with this illness, what cardiovascular manifestations have you been seeing?
Okay, one thing that seems to me rather sure, also according also to the Chinese series, is that cardiac patients are have an increased susceptibility. They are easier to get the infection, and the infection is more severe in the cardiac patients. So having an history of cardiovascular disease is a risk factor of a more severe and more deadly infection. Second, despite this, the clinical picture is generally, in my experience, dominated by the pulmonary infection, pneumonia and ARDS, and so hypoxemia and respiratory insufficiency. So this is the major problem. Are these lung infiltrates that we see. There is this exudate, this inflammation that impairs oxygen delivery to the blood and the cells. This is the major problem, and whereas heart failure by itself is not such a problem. It's a problem like any time. So the major need are oxygen therapy, ventilators, intubation, and if possible, ECMO as well, if the patient has also circulatory failure. Then this is the scenario which is overwhelming. Then there are other problems, probably also in this case related to the inflammatory activation that this patient may have. And you can see this from the laboratory exams, D-dimer, fibrinogen, ferritin, all increased. CRP, of course. And it's problems with the coagulation system. We may have thromboembolic events, including pulmonary embolism, and this may be also the first manifestation of the disease, or it may occur during the clinical course and even in a condition of well-being of the patient. There may be also arterial embolism, and according to other experiences, also hemorrhagic events. So all it's a mess with also with the thromboembolic, with the coagulation system, and it must be very carefully checked.
I really appreciate you highlighting the thromboembolism as a major complications, because these patients, when they're sick, really have all elements of the Virchow triad: stasis, injury, and hypercoagulability. So that certainly is something important to keep in mind. Sir, now you are editor-in-chief of the European Journal of Heart Failure and play key roles in many, key editorial roles in many influential journals. You're a scientist at heart with countless peer-reviewed publications. So I asked the scientist in you, what should researchers be focusing on right now with COVID, and what studies should we prioritize?
Well, it's a completely new disease. In my opinion, it's scaring because it's very powerful and deadly, but it's a completely new disease. If I may say, what I'm realizing every day, you have these patients. I mean, you have two phases. One is where the virus and viremia, and the other phase is when there is this inflammatory reaction with the pneumonia and worse. And what makes me feel very weak and without weapons is this inflammatory reaction that we see in the lungs. Very clear, very simple. We go back to the beginning, chest X-ray. We didn't think it was important, and now it's so important. And so you see this pneumonia, very severe, and we don't have anything to treat this. It's not going to respond to diuretic therapy, and therefore I think my priority would be to find a medical treatment, to find a treatment, effective treatment, able to improve these patients. we know that 10–20% of the hospitalized patients are going to need intubation or intensive care unit treatment, and if not dying. So I mean, the rate of the event rate is very high in a very short time, and therefore, I mean, I think it would be rather easy to find out treatment that can be effective. So, with all the respect, my priority is to find a medical treatment, evidence-based as much as possible, that's able to change the clinical course of these patients. Then also length of stay in the hospital is another parameter. Then, of course, I mean, there is so much to know. Diagnostic tests, increase the accuracy of the diagnostic tests, find out the prognostic variables and everything. But make people feel better is the priority. Yes. And also prevention with every tool, the vaccine, I mean, it would be, I mean, if possible, extremely welcome.
Thank you so much, sir. And you know, one silver lining really has been seeing how the medical and scientific communities have rallied together to produce data and coordinate large-scale randomized controlled trials. So I think we will be getting a lot of information to help us through this. So Professor Marco Metra, this has just been eye-opening for me, and your lessons will be useful for all of us. So thank you so much for the work you and your colleagues are doing, and for taking the time to share your COVID experience about this catastrophe, as you say, with us here at the Circulation COVID team. Thank you, sir.
Thank you. Thank you.